be watching some of the who have chosen to do the medical education panels. They are going to participate. Anybody who is here in person with us who wants to do the medical education panels will move to room 113 after I show a video. And I do want to reassure everybody, you can have the opportunity to see both the med ed and the advocacy panels. Everything's going to be put online about a week and a half afterwards. You're able to claim your med ed CME credits. If you watch them online, there's going to be instructions to do that. So you have opportunity to do both. I want to really thank our sponsors. Without our sponsors, we would not be able to put on this conference. We had a great day yesterday, and we're very excited about the presentations for today. So thank you all for coming back for day number 2. And a few real quick housekeeping. Program guide, everything is online. If you go to Docs for Climate and you go to the annual meeting, you will see links to all of the program guides, to the agenda, to information. Also, we're asking folks to tweet so we can amplify our message at #ClimateHealth2023. And again, if you're having any difficulties or challenges, you can go to info@climateconsortium.org. We have staff that are monitoring that inbox all day, or you can find me or one of the staffers that has a green dot on their badge, and we will help you solve any other issues. Okay, we already pretty much did that. We also are going to be hosting a communications workshop. If you use this hashtag, you can QR code, you can sign up. We'd love to have as many folks participate in these trainings so that we have the opportunity to, again, amplify our message and build our community. And before I start this last thing, I'm going to invite Ed up to the stage.
Good morning, everyone. I just wanted to do a spontaneous shout out to the members of our advisory council, the Medical Society Consortium Climate and Health Advisory Council, who are, you may know these people, but they are working quietly behind the scenes on all of our behalf to help the Medical Society Consortium move forward. And thank God Bill Novelli just walked into the room. Otherwise, I'd be giving a shout out to people, none of whom are in the room. But Bill Novelli is the co-chair of the advisory council. Bill is a longtime friend and mentor of mine. He is the he is actually widely acknowledged as the father of the field of social marketing, which has done a lot of heavy lifting for me because one of my areas of expertise is social marketing. Bill co-founded the firm Porta Novelli back in the early 1970s. It was really on the basis of that work that he created the field of social marketing. He went on to found the much later in his career to start the Campaign for Tobacco-Free Kids, which is really one of the landmark initiatives in terms of actually bringing the tobacco industry to its knees. He went from there to become the CEO and president of the American Association, AARP, what used to be known as the American Association of Retired People. And he is most recently at Georgetown Business School, where he has created the Business for Impact initiative. And so, Bill, thank you for co-chairing our advisory council. Also with us at the meeting, but not in the room, is Steve Schroeder, the other co-chair of our advisory council, who is a faculty member emeritus at the University of California, San Francisco. He's an internal medicine physician. At UCSF, he created the Smoking Cessation Leadership Center, which has done amazing heavy lifting in terms of making sure that every patient in America, who everybody who is a patient, that we are all asked whether or not we use tobacco. And if we do, we are in fact offered a standardized cessation counseling technique that is evidence-based and really does help move people up to move away from that addiction. Steve was also the president and CEO of the Robert Wood Johnson Foundation for about a decade, where he funded Bill to create the Campaign for Tobacco-Free Kids. So Bill and Steve have a really remarkable history together in terms of tackling some of America's biggest public health challenges and most formidable public health enemies. So Bill and Steve not with us, thank you both for what you are doing to move our advisory council forward. With that, I'll turn it back to you, Nicole.
I also have to thank Bill because he introduced me to Ed, which is how I found myself in this current position. And he was my boss at AARP. So very lucky for me. We're very, very fortunate that Senator Ed Markey is offering remarks. He was not able to be here in person, but he sent us a video. So we're going to watch that video right now. And hopefully this is going to work.
Thank you so much.
Thank you so much
Medical
to the
Consortium,
Medical Consortium
on Climate Health
for inviting me
to
join you
virtually today. And thank you for your essential, absolutely essential advocacy on this important issue. I'm just so excited to continue building the climate and health movement because it's all part of one movement. And we all have to work together to make that case. And, you know, the fight against climate change is the challenge of our generation. It's going to require efforts in every arena, from climate scientists to community leaders to doctors and nurses in our community health centers and our hospital workers and everyone else that's in the system. And if we put it all together, we can win this fight. We're facing an all-hands-on-deck crisis, and we have to respond the same way. The crisis is big, but so aren't we. And we just need climate action now. The past 9 years have been the warmest years on record for our planet. Pretty much every year is warmer than the year before, and that broke a record. 90% of American counties were hit by climate disasters between 2011 and 2021. Disasters that cost over $1.2 trillion and took thousands of lives. A lot of the oil and gas industry says we can't afford to do it. At $1.2 trillion of damage, we can't afford not to do it. And 2022 was no different. Devastating storms flooded Missouri and Kentucky. 83 tornadoes tore across the South, leading the news almost every night on national TV. Hurricane Ian caused tens of billions of dollars in damage and took more than 125 lives. That's just last year. And here's the truth. If we don't act now, every year will bring more deaths, more debt, more destruction. And this is a price we can't afford to keep paying. Prevention is preferable to cure. Let's invest in a whole of government, whole of health approach to tackle the climate crisis and build a livable future for everyone. And with my Climate Change, Health Protection, and Promotion Act, we can get this done. But we have to have a high energy level because we need to be resilient so that we can build resilient communities that protect their physical and mental health so that no one is left suffering from climate anxiety or from dirty air. With my Community Mental Wellness and Resilience Act, we can get this done. So thank you all so much for everything that you are doing in order to advance this agenda, because we absolutely need to make sure that the healthcare system decarbonizes their facilities by taking advantage of the Inflation Reduction Act's historic climate funding, tens of billions, hundreds of billions of dollars available so that we aren't making our planet sicker while working to make people healthier. Let's ensure that do no harm extends to all aspects of the healthcare system and our planet. When they put climate change on the agenda for Harvard Medical School and teaching young doctors, we know it's a big issue. So we need answers that are bold, that are comprehensive, so that all of the lives of people in our society, their health, is given protection. And that's why Congresswoman Alexandria Ocasio-Cortez and I will never stop fighting for the Green New Deal, because we need transformational climate action that matches the scale of this crisis. We can do this. We can come together, create jobs, create justice, make sure that everyone understands the role that climate change is playing in undermining the health of Americans all across our country. We're having tremendous success. The battle's going to be long. We saw an enormous success last year with the $369 billion that the president was able to sign in the largest climate bill of all time. But it would not have been possible if you didn't show up, if you weren't working every single day, and the work you do in the clinics, in the communities. It's all part of coming together to fight for climate action. So thank you for your unwavering partnership. Together, we will build a healthier world for everyone. We can do this. We're right. Our opponents are wrong. Health is the first wealth. That's what you live every single day. I'm really, really fortunate to be able to partner with you.